Welcome to Aging Insights. I'm Grace Egan, Executive Director of the New Jersey Foundation for Aging. Our mission is to promote policies and programs that enable seniors to live with independence and dignity in their communities. Today we're going to talk about Medicare. Open enrollment season is here, and there are important details that everyone needs to know. In addition, we'll also talk about ways to prevent Medicare fraud. This is something that Medicare recipients should always be on the lookout for. Today's guests are experts on both of these topics. I have in the studio with me today Angela Ellerbee and Charles Clarkson, both from the Senior Medicare Patrol of New Jersey. We know in New Jersey we have more than 1 million residents over age 65, and many boomers are turning 65 every day. So we want to highlight some of the details related to the open enrollment season. And with this, we'll begin the interview with Angela. Thank you both for being here.
Thank you for having us.
It's very nice. Angela, I know you and Charles work on the Senior Medicare Patrol throughout the entire year, but I know this is an extremely busy season for you, especially since you're both such fountains of information for the Medicare open enrollment period, as well as preventing senior fraud. So I'd like to start my questions with you. And can you remind our audience about what Medicare is and who's eligible?
Well, Medicare is a federal health program, and folks who are eligible are usually age 65 and older. Anyone that has end-stage renal disease, some sort of disability. Also, anyone that has the Lou Gehrig's disease, which is also the ALS, amyotrophic lateral sclerosis disease as well. So those individuals qualify for Medicare.
And what are the dates for open enrollment this year?
The open enrollment is October 15th, and it lasts through December 7th, with the effective date being January 1st of the following year.
So this year it would be December 7th. You have to have made all your decisions.
Right.
And then it would take effect January 1st of 2017.
Correct.
Okay, I just wanted to make sure. So we know that people are always coming new to Medicare because, as I said, there are boomers turning 65 all the time. So I'm just curious, so if somebody is enrolled for the first time in Medicare, say in September or say in July, does the Medicare open enrollment time impact them as well?
Definitely. I mean, when you're new to Medicare, that's called your initial enrollment period. So you have 3 months to go into a prescription drug plan, Part D prescription drug plan, the month that you become eligible, which is usually your 65th birthday, and 3 months after that. So once you become enrolled into the prescription drug plan, let's say in April, you still have an opportunity through the Medicare enrollment period, which, as we said, was October 15th and lasts through December 7th, to go into another Part D prescription drug plan.
But do you have to? That's my really question. So suppose you enroll, your birthday's in September, and all of a sudden it's open enrollment. Are you supposed to go in and almost enroll again, look at the plans again?
Well, it's good to review. It's always good to review. I mean, you may be in a plan that you find out your prescription no longer is going to be covered in 2017. The prices may be different. The premium may be higher. And so what you want to do is go to the Medicare.gov website or go to a SHIP counselor, or you can go online yourself or call 1-800-MEDICARE, and you can do a comparison to see if a Part D prescription drug plan for 2017 will be better fit for you. If it's not, you could stay.
I guess the reason why I ask is if somebody is new, they say, oh, I've taken care of that, it's all done. And then all of a sudden, there's open enrollment time again. And so I just wanted, and if they don't go in, what happens if somebody doesn't go in to change anything?
Then they're in that plan until the following year.
Until the following year.
Yeah, so it's good. It's always good to review.
It's always good to review. And I would imagine that there are lots of resources. I just also want to say, do people get mailings from other sources, like the new Medicare Advantage plans that say, switch to us? Do they get those during open enrollment?
During open enrollment, you'll get a lot of letters. So you have other insurance companies like Medicare Advantage plans soliciting their plans to you. So definitely. You'll also get a letter from your current plan stating if there is any changes for 2017. So yes. And then, you know, also other media outlets will also advertising on TV, you'll see commercials, you see billboards. So yeah, there's a plethora of information that'll be out there for people to know about the enrollment period.
Okay, I just figured that we'll be maybe defining a little bit the difference between traditional Medicare and Medicare Advantage. But it sounds like there's a lot of decisions to be made. What kind of resources are out there for people to kind of sort through these details?
Well, one being the State Health Insurance and Assistance Program.
Also known as?
SHIP.
SHIP.
And I was a SHIP coordinator for a county, Essex County, for a number of years. And I'm still a SHIP counselor, and I take great pride in doing that as well. But the State Health Insurance and Assistance Program, it's a funded program through a grant. And counselors are trained, and they will also help you do a comparison on the Medicare.gov website to see if there's a plan that's good for you as well. You can also reach out to 1-800-MEDICARE. You know, some folks are not computer savvy, and they may not be able to go online, so they can call 1-800-MEDICARE 24 hours, 7 days a week, and get an operator that can also do it as well.
24 hours a day?
Yes.
That's pretty impressive. Yeah. And I see you have a book in front of you. It looks like there must be some hard copy materials for Medicare too.
Yes, when you're new to Medicare, you get a Medicare New book. And in the Medicare New book, it also will tell you about the Medicare Open Enrollment as well. And other information, it also lists the Part D prescription drug plans and also what is called Medicare Advantage plans as well.
Okay, and so these materials are available in other languages?
I believe it's just in Spanish, but there's other publications out there that will tell you about the Medicare Open Enrollment period online. So if you go on the Medicare.gov website, it can give you information about the prescription drug plans and how to enroll. So I think there's Korean, there's Chinese, Japanese, there's other languages that you can check out. And if you do call 1-800-MEDICARE, operators, if you need someone that speaks your language, they'll put you on to someone that does.
Oh, well, that's helpful. So if someone calls and they speak Hmong or they speak another language, then they'll just get somebody on the line to help. That's very important, I think. And you mentioned Medicare Advantage. You want to describe the difference between a traditional Medicare and a Medicare Advantage?
That's a biggie. I will say that traditional Medicare, original Medicare, red, white, and blue Medicare card, on it, it has Part A hospital, Part B medical. Okay. Everyone that's on Medicare, that's what you get initially. With a Medicare, original Medicare, it pays 80% of a bill after deductibles are met. So you want to purchase a supplemental insurance that pays the 20%. So you got that 80 and the 20, it's 100%, and then you're covered when it comes to medical. Also, you may want to purchase a Part D prescription drug plan as well. So now you have the complete coverage, you have medical, and you have prescription as well. Medicare Advantage plans are private companies that contract with Medicare to give your medical, to meet your medical needs. So the Medicare Advantage plan, it does have the basic Part A and Part B coverage as well. So it has to have that. Some of them come with prescription drug plans. So you have your medical and your prescription drug plans in one card. So that's loosely the difference between both of them. With traditional Medicare, you can go to almost any doctor that contracts with Medicare, that accepts Medicare.
That accepts Medicare.
Right. With a Medicare Advantage plans, most of them are HMO plans or PPO plans, so they have a network of doctors that you want to stay with. With the HMO plans, you stay with those doctors, your fees are very minimal. When you go out of network with the PPO plans, you may pay out-of-network fees, and they're higher cost.
So it sounds like, so I just want to go back a little bit. So traditional Medicare includes A and B.
Yes.
And then sometimes Medigap policies are referred to as Plan C?
Well, no.
No, okay.
There are Plan Cs in Medigap plans, so there's Plan A, B, C, and so forth. But Part C is otherwise known as the Medicare Advantage plan.
Oh,
yes.
See, I didn't know that. Okay, well, that's good. I feel better now. I understand something new and different. I just presumed you were really trying to target A, B, and C, and D. So, and D sounds like the most complicated to discern if it really is covering your prescriptions.
Right.
Is there any prescription coverage with A and B?
You do get some if you're in a hospital. So if you're in a hospital inpatient, Part A covers certain prescriptions. So yes.
Okay, so let's take a little bit of time drilling down onto Part D.
Okay.
So Part D, I know there are, using this alphabet, there's Part D, and then there's like A to O or something in there. Is that right?
That's why it's important to talk to a SHIP counselor. And I always, when we go do presentations as well, we talk about the SHIP program, that State Health Insurance and Assistance Program. Really important because you can have that one-on-one personal conversation with the SHIP counselor. The SHIP counselor will break down all of it for you. So by the time you finish with the SHIP counselor, there is no guessing what kind of coverage you need. You'll know what coverage that you need and you'll get that coverage. So they'll break down the different parts of A, B, C, and D.
And D. We should let people know that there are about 450 to 500 SHIP counselors throughout New Jersey. And as you said, it is supported by the federal government.
Yes.
And many of those SHIP counselors are based at the county offices on aging. And so I know you mentioned Essex, and now you're working with Charles, and so that knowledge is cumulative,
Yes,
and you
yes.
get to sort of bring it along with you. So I think that's good. So again, the resources that we want to direct people to, you've said it many times, but it's Medicare.
Medicare.gov, important. The Medicare.gov has the what is called the Medicare 2 finder, and that helps you compare your Part D prescription drug plans. Also, 1-800-Medicare. If people can't get on the internet, they can't get on the computer, you call 1-800-Medicare, very important as well. And a SHIP counselor, the State Health Insurance and Assistance Program, the counselors are there. Utilize them. They're very good, and we're very good at what we do, and we enjoy what we do.
Well, and you're well trained, I have to say. They're always giving you updates on what's available.
Definitely.
So I think that's very helpful.
Yes.
I was going to say and when people start their Medicare benefits, they should look for certain mailings to keep them up to date. So can you describe what's covered on the Medicare claim explanation?
The Medicare summary notice.
Yeah.
Medicare.
Okay. Well, on the Medicare summary notice, what happens is this. When you use medical services or go into the hospital, Part A and Part B, you will get what is called a Medicare summary notice. And the Medicare summary notice obviously has your name on it, has the address, and it'll also state the date of service, the provider that you saw, the services that was rendered, what is the provider charged, what Medicare allowed and what Medicare pay, and what your co-payments or co-insurance could possibly be.
So it's not unlike the medical benefits explanation that we would get normally with health insurance if you weren't a Medicare recipient. I mean, that usually comes in. It might say this is not a bill, or it might say this is a bill.
It will say this is not a bill. That you're correct.
So I mean, I think it's good, and I wanted to mention that before we go to Charles, because I know that's an important document to prevent Medicare fraud. So Charles, why don't you explain to us a little bit about the special focus of the Senior Medicare Patrol?
Okay, well, again, the Senior Medicare Patrol of New Jersey is a federally funded program. Every state has a Senior Medicare Patrol.
Okay.
So I think there are about 54 if you include Guam and the Virgin Islands and whatever else out there, American Samoa, whatever it is. But our job really is to educate people about what's involved in Medicare fraud and what to watch out for. That's our main focus, and we do that by doing outreach. So Angela and I both do a lot of outreach, and I almost do a presentation a day in some of the busy periods.
You're difficult to track down and to sit with us, so I appreciate
but it's it's fun, and I enjoy actually meeting all the thousands of seniors. We probably, even though we go and do everything every day, and we might reach 25,000 seniors one-on-one.
Impressive.
Yeah, but and that's why we like to come on television, and we also do radio, we also do newspaper and magazines so that we could get the word out. So I know we had a big article in the Star Ledger, and we got thousands of calls. It was wonderful.
I saw that article, and I thought it was good because it was also tied to fraud. And so what kind of fraud are we really talking about?
Well, let's give an overview. Medicare in 1 year, they estimate loses $60 billion in fraud.
Incredible.
And that doesn't even include Medicaid and private insurance. So if you add all that up, we're talking $250 billion a year. And I always ask this when I go to a presentation, well, who pays for that?
Right.
We all do.
We all do.
Comes out of our tax dollars. So one of the big things that all Medicare beneficiaries must do is fight Medicare fraud, waste, and abuse, because the money is coming out of their pocket.
So what kind of fraud? Are we talking about double billing, or are we talking about I didn't even go there?
I'll give you three of the common frauds.
Okay.
Obviously, the big one is billing for services never provided.
Okay.
A second one, double billing. A third one, upcoding, where the provider bills for a higher code than the one actually provided, so he can make more money. And our job, at least one of the big things we tell beneficiaries, you must read your Medicare summary notice carefully.
Right.
And you could also get that online now, but a lot of seniors, at least the last generation are not computer savvy, so they're not getting their MSNs online. But you can do that. So we're hoping millennials, and I don't even know what the next generation after that is.
I just refer to everybody as a boomer.
Boomer,
Everybody.
millennials,
Everybody
whatever
wants to
after
be a
that.
boomer.
You know, you can actually go online now and see your Medicare summary notice as soon as it's posted, which could be 3, 4, 7 days.
After the
which is
doctor
great
visit.
because, you know, the Medicare summary notice that I have a copy of here won't come for 90 days.
Oh, okay.
So that's a long period of time, and the quicker time that we can discover fraud, the easier it is for us to get the money back for the Medicare Trust Fund. So, but the big thing is most people, you get your Medicare summary notice in the mail, read it carefully. Don't presume that just because Medicare paid it, it's right.
Well, I think that's an important point. What about equipment, durable equipment? Is that?
Yes, one of the big areas of Medicare fraud. You know, I always tell people at presentations, you know, you see commercials on television all the time for back braces, knee braces, neck braces. Scooters, big one.
Yeah.
Ignore them all. Because what you really need is determined by you and your doctor.
Right.
I mean, if you need a wheelchair, you shouldn't need to go to a commercial and decide, you know, I think I'd like one of those. You know, it has to be medically necessary for Medicare to pay it. And you also have to require it in your home to get around. You can't just take it for a pleasure cruise down the sidewalk, even though it's what they show on the television commercial. So yes, durable medical equipment is very, very large in fraud. As a matter of fact, now Medicare has instituted a new pre-approval system where people allow, let's say for a scooter, they'd have to send in the claim earlier in the claim process so Medicare can approve it. And then you can get it. If you don't do that, then Medicare won't pay. So Medicare is expanding this program more and more because even though there have been complaints that it you know, it denies access to services, there's so much fraud. We have to do something to stop it. And I don't think it really makes a difference in the access, but that's what the providers are complaining about.
Oh, sure. They would like a carte blanche.
I'd like to give the other side, too.
I'm just curious. So equipment, is that under A, B?
That's
D?
under Part B.
Okay. there
That's
you
on
go.
Part durable medical equipment is a Part B in Medicare because Part B is very expansive.
Okay.
It's outpatient, it's labs, it's X-rays, it's durable medical equipment. It's a very large program. Part A is when you're going into the hospital.
Right, okay. And so I guess I'm curious, as you said, the Medicare claim form is what's really, what did you don't call it that, what do you call it?
Medicare summary notice.
Summary notice.
Yes.
Is so if someone looks at that and they actually see a problem, what do they do then?
Well, we basically say there are two things they should do. Number one, if they look at their doctor's claim and they say, well, you know, I never got that test, at least I don't remember it.
Right.
Call the doctor's office and see if they can correct it. And be very insistent and make sure you always see a follow-up bill or a claim showing that you got the credit.
A correction.
A correction. If that doesn't work, you know, sometimes the doctor's office will say, yes, we'll take care of it, but you never hear from them again. They don't call you back. You don't really speak to the doctor. You speak to the billing department. And well, then call the Senior Medicare Patrol of New Jersey. That's what we do.
That's what you
we
do.
have 50 trained volunteers throughout the state. And basically these trained volunteers are really been trained, and they like to go after doctors or hospitals or labs to fight Medicare fraud.
Only because they want to fight Medicare fraud, not because they don't
Not
like
because
it.
they hate doctors.
That's right. Okay, let's get that out there.
And that's what we ask you to do. Call us. Let us help you. It's free. We're not charging anything.
Right.
We're unbiased.
Right.
You know, we just want to get it corrected. And we don't know if it's fraud. It could be an error. There are a lot of errors made. Wrong codes are put in.
Right.
You know, maybe the person wasn't there that day. Someone made a mistake. So anything could happen.
You know, I didn't ask this before, but it makes me think there probably are companies that say, let us help you set up your Medicare program.
Yes.
But people don't need to do that. From
No.
what Angela said and what you just said, you can call Medicare, you can call the doc if there's a problem.
Right. We always suggest to people that, you know, if you're going to a broker or an agent,
Thank you.
then that person is getting paid.
Right.
and he may only get paid because he put you in certain plans.
Right.
So he's not looking out for your best interest. I'm not saying that's true all the time,
Right, it's not
but
true
he
all the
may
time.
not. And
Right.
he may have a conflict of interest because he's only representing certain plans.
Right.
So go to the State Health Assurance Assistance Program for unbiased help. Call the Senior Medicare Patrol. We can help you, or we can refer you to the SHIP program. Yeah, there's no reason that you have to pay for this service.
Right.
And even though you may not be paying, the insurance company
somebody
may be
else might
paying
be,
the commission.
yeah.
So someone is getting paid, and that might not be in your best interest.
And that might be more true with Medicare Advantage plans, I'm thinking, than with the regular traditional Medicare.
Absolutely. We have a lot of issues where agents or brokers are trying to put people into Medicare Advantage plans that may not be suitable for them. We've seen that plenty of times, and it takes a lot of work to unwind that and get you back
Right.
to original Medicare. So we also tell people, don't let agents and brokers in your home. First of all, they're not allowed to call you unsolicited, but
Okay.
they do.
They do.
They knock on doors,
That's
you
right.
know. So be very, very circumspect when that happens. You know, don't let them in. Don't let them convince you. Don't let them put pressure on you with pressure tactics, saying, "Oh, we have a deal for you, but you have to sign now."
Yeah, right.
That kind of thing. Yeah, why do that when you can get it for free and get it unbiased?
Well, I think that's an important point, and I hope people understand that. So you both go around the state and you talk about Senior Medicare Patrol, and I'm sure you get 1,000 different questions. So why don't you talk about, you did mention some of the groups, but you go to senior centers?
Oh, yes. Senior center. I think I've been to every senior center in the state of New Jersey.
There are a lot of them.
There are a lot of them. Almost every town
Okay.
has a senior center, and 520-something towns in New Jersey.
we have a lot of towns, so
There's still some I haven't reached, but I'm trying
They'll
to
be
get there.
calling you now, so there you go.
Yes, and of course we go to senior groups, we go to churches, we go
Right.
to synagogues. Anybody that'll invite us,
Right.
we'll come out to. And there are a lot of private clubs, women's clubs, men's clubs,
Sure.
that we don't hear from because we can't reach them. They're private. They're not listed anywhere.
Right.
So if you want a presentation for your club or your group, just call us, and 732-777-1940. Ask for the Senior Medicare Patrol, and we'll do it. And we do it anytime, day or night.
Right,
right.
and so they can set up a date, given
That's
your
right.
busy schedule. I'm curious, what are some of the questions you get from seniors? Because while we're talking about fraud, you must get a lot of other questions. I mean, what do
Well,
you
sure.
hear?
We get a lot of question about prescription drugs.
Okay.
And that's another area that people need to watch out for because, getting the wrong drug can literally kill somebody. So we always want people to make sure they check their drugs, count the number of pills in their thing because it's called short pilling.
Oh, okay.
And we want to make sure, it happened to me. I'm on a medication. I get 90 at a time. About a year ago, I only got 60. So I went back to the pharmacist and I said, hey,
Really?
there's 30 short. He said, oh, Mr. Clarkson, it's a mistake. Here's the other pill. But I said to him, I investigate Medicare for it. He got a little nervous. He said it won't happen again. So, but always count your pills and make
Always.
sure they're the right pill. Look at the color, the size, the shape,
Right.
the shape, the marking. Because taking the wrong pill can have really, really dire consequences.
So this is one of the more common concerns you hear
Yes.
about.
Yes.
Yes.
Especially as you get older and you might forget. So we
Right.
encourage people to use a system where they know what pills they're taking all the time, every day, so they don't get confused. Because a lot of people don't have someone looking over their shoulder to help them.
Right, exactly. And I imagine that there are some scoring or some accounting that, I see you brought your personal care journal.
Yeah, so I always tell people when I'm doing a presentation, I'm usually the youngest person in the room, and I say to them,
Really?
Really, and I say to them, I can't remember what I did yesterday.
Yeah.
How do I remember what I did 90 days ago? You remember it takes 90 days
that
to
is-
get
that
a
is a
Medicare
long time,
summary notice. If you're not doing it online, it takes 90 days. So how do you remember? Well, keep a calendar. Every time you go to a doctor, write it down. What tests you took, what questions you asked. And then when you get your Medicare summary notice, you compare the two. And if there's something is amiss, then you say, there could be a problem here. Let me call the Senior Medicare Patrol after I call the doctor maybe, and then see if I can get this resolved.
Yeah, I think it's important whether there's a booklet or a little
Anything you
notebook that
use.
somebody has,
Right.
Where they're writing down.
We hand these out because they're convenient, and we order them in bulk,
Right.
and we hand them out at every presentation.
I think that's very helpful. And so again, you've talked about how people reach you. I mean, how long is a regular presentation that you do?
Well, it could be anywhere from 30 minutes to an hour,
Okay.
depending on how many questions, whether people fall asleep. I happen to be I think people like my
You're
presentation.
very entertaining.
I am entertaining. No one has fallen asleep yet that I can tell. And and of course, we can do it as short as 10 minutes or as long as an
Right.
hour. And, I always encourage questions during the presentation because I want to see where it's going.
Right.
And sometimes a beneficiary will ask a good question and say, let's talk about that.
Right.
So I always find it very, very helpful.
Right.
And of course, I always hang around afterwards because some people might have some personal issues.
They might have some personal issues,
And
right.
I don't rush out the door.
Right.
So, and I'll sit there as long as I need to, unless I'm running off to do a second presentation. But that's I don't do usually. I sometimes do 2 a day, but not 3.
Right. So when you figure out that there is a problem, and you've made a certain calls and you've worked with the senior, what's next?
Okay. Well, what happens is this. We get your consent. So we have a standard form that says, hey, we're the Senior Medicare Patrol. You've asked us about this issue. You're basically consenting to us to represent you in this matter, okay? We then assign a volunteer to that case. And that volunteer's job is to get all the facts,
Right.
especially review the Medicare summary notices, which some seniors don't really have or have access to.
Right.
So we tell them how to do that. You can call Medicare and get them, and we also have a unique ID program with Medicare. So I can call up and I can say, hey, I have this person's name, my number, and the birth date. Tell me what the claims listed are.
Okay.
Because sometimes the beneficiary forgets, and I want to be factual
Oh, sure.
about what's going on and what the facts are, and sometimes the beneficiary isn't the best person to know the facts. So we want to get the facts, we want to review all the matters. Unfortunately, it takes time. People expect us to do it quickly, but we can't do it quickly.
So it may take time. So when you want it to really be resolved after you've done all that work, who do you turn the case over to?
Well, we have a number of partners.
Okay.
The overview site for Medicare fraud is the Office of Inspector General.
Okay.
So, we had a big case for genetic testing that we discovered.
Yes, that's right.
And we couldn't resolve that in-house ourselves, so we sent it to the Office of Inspector General. Also, the U.S. Attorney is
Okay.
involved. So there are a number of people out there. There's also the Medicaid. If it's a Medicaid issue, there's the Medicaid Fraud Control Unit.
Okay.
So there are a lot of people besides us fighting Medicare fraud, but those are big. They like big cases.
Well,
we'll take a $100 case.
I think it's really helpful. I really appreciate you going through all of these details, and it's a very important topic. So I want to thank you both for sharing your time with us today. It's just such important information. Aging Insights is produced by the New Jersey Foundation for Aging. To give us feedback on this show or to sponsor future Aging Insights programs, please go to our website at www.newjerseyfoundationforaging.org, or you can call our office at 609-421-0206. And we want to remind you to find out about senior services in your area or to reach your local SHIP counselor. Please contact your county office on aging. You will see a listing of their numbers on our website, or you may call the state hotline number at 1-877-222-3737. Thank you for watching this episode of Aging Insights, and remember, aging is everyone's business.